Hey guys, Amanda Curtis, nurse practitioner. Wanted to jump on and address this person's question asking for me to go in depth about other peptides. So for this, I'll talk about BPC-157 and wanted to bring to everyone's attention a very recent study that was released. It was Yildirim et al. And it was 2026 in the Journal of Clinical Medicine. This was as of May 2nd, 2026. And it was the first investigational study about BPC-157 in human arterial tissue. So just to explain what they did, they took 12 different patients undergoing elective CABG surgery. So that's going to be a coronary artery bypass surgery graft. And so what they did was they took out segments of human arterial tissue, so out of the body, and they took endothelial intact. So that means the lining of the vessels was intact. They took some endothelial denuded rings where they removed the endothelial lining, and then they had some pre-incubated rings that were treated with a nitric oxide inhibitor. And so they placed basically these cross sections of each of the rings after they had been removed from the patients and they were elective surgeries. So then they pre-contracted them with phenylephrine. So that means they shrank them down or like contracted them very tightly with a vasoconstrictor. And then they applied 5 consecutive doses of BPC-157 in different concentrations. And what they saw essentially was that there was a concentration-dependent vasorelaxation mechanism of BPC-157 in human tissue. So what this study confirmed really was the BPC-157 utilizes the nitric oxide pathway for its mechanism of action for the endothelial lining in our vessels. So they did also see some residual endothelial-independent effects. So that means on the denuded rings where they took the endothelial lining out, they did still see some relaxation in these basically cross sections. And so they know that BPC-157 doesn't just act in that pathway, but there are other, and it responded at higher doses of the BPC-157. So this study is important because it really makes that jump between, again, we have rodent model data, and now it's confirming basically the pathway that BPC-157 acts in human tissue. So it's the vascular endothelial growth factor that then activates the nitric oxide cascade that causes the vasodilatation that they saw in these arteries. So while this study does have its limitations, it was a small sample size, so they utilized 12 patients that had undergone this surgery. So a smaller sample size. It was also ex vivo, so that means not in the body. It was after the portions of the endothelial lining had been taken out of the body. It showed that maybe the concentrations of BPC-157 were going to be higher than what they would actually be found in the body, let's say from an injection. So just understand that this study does have its limitations. It does show a correlation of what's happening in the animal, the rodent model data, and then we now have an established pathway that it works in humans. So exciting news. We always are finding new things out, and thanks to this group of researchers for getting us some more information on BPC-157. So stay tuned. We'll go over some more things in the future.